results of the phase 1b study of the combination of pembrolizumab and regorafenib in patients with advanced HCC. These are interim results presented focused on the 80 milligrams cohort. But to put this abstract in context, I'd like to remind you that this is an ongoing study of these combinations in patients with advanced HCC who have not had any prior systemic therapy. So this is now a first-line study. We had previously presented results on the combination of pembrolizumab and regorafenib from the dose escalation portion, where during that portion, the MTD was determined to be regorafenib 120 milligrams with pembrolizumab at its standard dose of 200 milligrams IV every 3 weeks. In that expansion cohort at 120 milligrams, what was noticed is a promising response rate of 29% and a stable disease rate of 65%, with a disease control rate of 94%. What was challenging, though, at the 120 milligram dose is that several patients, a high proportion of patients required dose interruptions or discontinuations. When we look specifically at regorafenib, 23% of patients had treatment discontinuation due to regorafenib-related toxicity, and 66% of patients had some sort of treatment modification, meaning a dose reduction or interruption, second regorafenib-related toxicity. Due to these issues, we decided to explore a lower dose of regorafenib, which was 80 milligrams. So this abstract presented by Dr. Richard Kim at ASCO GI 2021 focuses on the evolving data from the 80 milligrams cohort. And in this cohort, we see that the grade 3 and 4 toxicities that are regorafenib related were at 36%, which is lower than what we saw at 120 milligrams. And those that were pembro related were at 23%. Similarly, the regorafenib related toxicities leading to treatment modification were 27%, so significantly less than the 60% we saw at 120 milligrams. And the toxicities that were regorafenib related leading to permanent discontinuation of regorafenib were at 9%. It appears, again, by comparing these two cohorts side by side, this is not a randomized comparison, that there is better tolerability at the 80 milligram dose level of regorafenib. The efficacy data is immature and still evolving. Many patients are still on treatment, so I think I would take the efficacy data right now with a grain of salt. The disease control rate is still at 86%, but the partial response was 14%. But again, we will update this as we have longer follow-up from this 80 milligram cohort. This combination of pembro and regorafenib, the results are consistent with other results that we have been seeing when combining anti-PD-1 or PD-L1 therapy with VEGF-targeted TKIs, where all these combinations are showing similar response rates and disease control rates that are quite promising. Certainly, combinations now are being evaluated in the phase 3 setting, and this combination is also being evaluated in the second line setting currently in patients who have progressed on prior PD-1 therapy, including the combination of atezolizumab and bevacizumab.